Have you noticed all the Medicare Advantage mailers these days say HMO in big bold letters? You're not imagining it. Something really is changing. You're not being forced to switch, you're being funneled there. In 2026, more and more Medicare Advantage plans are shifting away from PPOs and launching new HMOs instead. And if you've always liked having freedom to see any doctor or hospital, this shift is worth paying attention to. By the end of this video, you'll understand why the market is moving towards HMOs, what it means for your doctor, your benefits, and your total costs, and how to know whether keeping or changing your plan makes sense before your next Medicare decision window. Quick question before we start. Are you on a PPO or an HMO right now? And why? Drop it in the comments. I'd love to see what people are choosing this year. Okay, let's start with a quick refresher. A PPO or preferred provider organization gives you more flexibility. You can usually see any doctor or hospital that takes Medicare, even out of network. You just might pay more, sometimes a lot more, if they're not part of the plan's preferred network. An HMO, or a health maintenance organization, is tighter. You'll usually have to pick a primary care doctor, stay inside that network, and in many cases need a referral before seeing a specialist. Now, historically, people have preferred PPOs because they feel like a safety net. If I get sick, at least I can go wherever I want. That flexibility used to be the big selling point. Matt tip: if your plan says PPO, what you're really paying for is choice. And that choice costs more than most people realize, either through a higher monthly premium or benefits that are just okay. So, why are carriers suddenly pulling back on them? Well, let's talk about what's changing behind the curtain. Medicare Advantage insurance companies aren't transforming your PPO into an HMO overnight, but many are quietly making business decisions that make PPOs harder to find or less attractive. Here's what I'm seeing heading into 2026. PPO product offerings are down, while HMO and something called special needs plans, well, those types of filings are up. Many Medicare insurance carriers, including big ones like United Healthcare, Humana, and Aetna, have cut or eliminated commissions on certain PPO products. That's kind of the industry's way of saying, we're not looking to grow this line of business. Why? Because PPO members actually use their plans. People go out of network. They visit the top hospitals and use the flexibility they're paying for. And that means carriers can't manage total costs as predictably as they can inside an HMO. In many areas, hospitals charge Medicare insurance companies higher rates to be a part of those broad PPO networks. Well, for years, carriers accepted that because, well, PPOs sold. They were popular and they helped companies grow. But after several rough financial years, 2026 looks different. Carriers are now prioritizing margin over member, which means they care less about adding or keeping you as a customer and more about whether or not they can make money on you as a customer. It's not entirely their fault either. Every company needs to make a profit, but the reality is federal reimbursements have tightened. Hospitals and doctors are billing more, and people are using more healthcare than they used to. It's a trifecta, and HMOs are the industry's way of tightening control over those costs. Matt tip: when a company stops paying independent insurance agents to sell a plan, that's not a good sign for you. It usually means they're fine if new people don't join, and if some current ones leave, it's fine. So if your favorite PPO is suddenly gone or the renewal benefits or premium looks worse, it's not your imagination. The company might simply be shifting its focus elsewhere. Now, here's where the growth is happening. Across the country, new HMO plans are popping up with richer dental, vision, or grocery benefits. On paper, they look more generous, and that's the point. Carriers can offer those extras because they expect to save money elsewhere. Inside an HMO, they can manage care more tightly by narrower provider networks with lower negotiated payment rates to doctors and hospitals in their networks, care coordination through a primary care gatekeeper, more prior authorization rules that let them oversee utilization. That means more control for the carrier, more predictability for their budgets, and sometimes more hoops for you to jump through. You might have seen the headlines about Mayo Clinic dropping out of most Medicare Advantage networks with United Healthcare and Humana. Well, Johns Hopkins, Cleveland Clinic, Scripps in California, and New York Presby have all had similar disputes recently, and those are just the big names. There's a lot more. Here's the trade off: large medical centers often charge higher rates. And when insurance carrier margins tighten, well, they're the first to go. Whether it's hospitals demanding more money or insurers refusing to pay higher rates, you end up stuck in the middle in a plan you thought gave you access until the game changed. Matt tip: when a major hospital drops off of your plan, it's almost never about care. It's about contracts. And unfortunately, Medicare patients are the ones stuck paying the price. There's another piece of the puzzle most people never hear about: SNPs, or Special Needs Plans. These are Medicare Advantage plans built for specific groups: people with chronic conditions like diabetes or heart failure, people living in certain care facilities, or people who also qualify for Medicaid. Almost all SNPs are HMOs, and carriers love them because they get higher federal payments for C-SNPs, those are the chronic condition plans, and dual payments from both Medicare and Medicaid for D-SNPs. That makes them especially profitable to run. They use that extra funding to build disease-specific perks and benefits into these plans, and yes, to protect their margins. That's why you're seeing so many new SNP filings and D-SNP Medicare and Medicaid billboards popping up everywhere in 2026. They're marketed as specialized care, and they are, but they're not always better than a regular Medicare Advantage plan. They're also part of the bigger HMO expansion trend. Matt tip: special needs plans can be great if you qualify. Just remember, they exist because carriers get paid more to manage those conditions. That's not good or bad. It's just business. So, what does all this mean for you, whether you're comparing plans during open enrollment or just getting ready to make your first Medicare decision? Well, first, you're not being forced, you're being funneled. PPO choices are shrinking, and HMO marketing is everywhere. The big push is toward cost control, not consumer freedom. That doesn't mean HMOs are bad. For many people, they work fine. Lower premiums, solid benefits, and if your doctors are in network and you rarely travel, they can be a perfectly good fit. But if you value flexibility or you've had a big health event recently, this shift could limit your options next year. Here's how to make sense of it, whether you're reviewing your current coverage or getting ready to choose your first Medicare plan. Number one, review what's changing. If you're already on Medicare, start with your annual notice of change. That shows any premium, drug, or benefit changes for the next year. If you're new to Medicare, this is your chance to compare how each plan handles doctors, drugs, and costs before you enroll. Number two, decide how much flexibility matters to you. If seeing specialists without referrals and having more provider options is important, focus on PPOs. If lower costs and a coordinated network fit your situation better, HMOs can make sense. Just know the trade offs. Number three, call your key doctor's offices and confirm the exact plan name they'll take next year, not just the carrier name. Number four, if your current plan is ending or you're choosing for the first time, pay close attention to what replaces it. Many of the new 2026 options are, again, HMOs, so understand how that affects your access and your out-of-pocket costs before you sign up. Matt tip: the best Medicare decision isn't the flashiest ad, it's the plan that fits how you actually use healthcare. Here's the bottom line: 2026 is shaping up to be the year of the HMO. Not because they're better, but because they're easier for insurance companies to control. You still have choices, but those choices are shifting. Know exactly what you're enrolling in and don't assume the same plan name or brand means the same coverage. If you're ready to review your options or switch, visit brickhouseagency.com. My wife Nikki and her team can walk you through your choices over Zoom or phone with no pressure and no obligation to enroll. I'm Matt Ferret, here to help you make smarter decisions about Medicare and retirement and to save you time and money along the way. Until next time, here's to your wealth, wisdom, and wellness. But before you go, hit that thumbs up if this helped you and tell me in the comments, HMO or PPO? Which one are you choosing this year and why? See you next time on Prepare for Medicare.